Bismillahirrahmanirrahim. The quote of the day is always be a beginner at something and always be in love with what you are beginning. Today the topic of discussion is food poisoning. The learning outlines are introduction, epidemiological determinants, chain of transmission and communicability, clinical manifestations, level of prevention, and recent advances. The learning outcomes are, by the end of this presentation, participants will be able to describe the epidemiological determinants, clinical features, and prevention strategies. Introduction. Food poisoning is an acute gastroenteritis caused by ingestion of food or drink contaminated with either living bacteria or their toxins or inorganic chemical substances and poisons derived from animal and plants. It is characterized by history of ingestion of a common food, many persons affected at the same time, and similarity of signs and symptoms in majority of cases. The problem statement. Food safety is a public health priority. Unsafe food possesses global health threats, endangering everyone. Infants, young children, pregnant women, the elderly, and those with an underlying illness are particularly vulnerable. Every year, 220 million children contract diarrheal disease and 96,000 die. Unsafe food creates a vicious cycle of diarrhea and malnutrition, threatening and the nutrition status of the most vulnerable. The US Center for Disease Control and Prevention estimates 1 in 6 Americans, or 48 million people, are affected by foodborne illness annually. The estimates suggest 128,000 people are hospitalized and 3,000 die. The epidemiological determinants are age, agent, host, and environment. The agents are categorized into bacterial food poisoning and non-bacterial food poisoning. In bacterial food poisoning, there is Salmonella, Staphylococcus aureus, Clostridium botulism, Clostridium perfringens, Bacillus cereus, E. coli, Vibrio cholera, Clostridium jejuni, and Listeria. And non-bacterial food poisoning, there are viruses, parasites, and others. In viruses involved are norovirus, hepatitis A virus, and rotavirus. In parasites, there is toxoplasmosis, and in others, the chemicals such as arsenic, certain plant and seafoods, fertilizers, cadmium, and mercury, and pesticides. To come towards the Salmonella food poisoning. Salmonella food poisoning is an extremely common type. The reason behind it is due to increase in community feeding, increase in international trade in human food, increase in incidence of salmonellosis in farm animals, and increased distribution of prepared food. The incidence of salmonella infection in Pakistan is 412 per 100,000 person years according to the WHO, and it is among the highest in the world. The agent for salmonellosis for food poisoning is Salmonella typhimurium, Salmonella chlorosis, and Salmonella enteritidis. It is a gram-negative rods, non-spore forming, predominantly motile enterobacteria, and facultative anaerobe. In host factors, it involves all age groups and both sexes, but more common in children less than 5 years age and elders. There are two licensed vaccines against Salmonella typhi that are currently available. One is orally administered live attenuated vaccine TY21A, that is Vivotif, and the other is injectable V1 capsule polysaccharide VICPS vaccine, that is a Typhirix or Typhon V1. Environmental factors, humans get infection from farm animals and poultry through contaminated food, eggs, milk, and milk products. Rats and mice often heavily infected and contaminated food stuff by urine and feces, warm weather, and unrefrigerated food. In social factors, low standards of personal hygiene, lack of education, and poor quality of life contribute. The symptoms of salmonella food poisoning are fever, abdominal cramps, and diarrhea that starts 12 to 72 hours after infection and usually lasts for 4 to 7 days. It is more common in warmer weather and in unrefrigerated food. It can spread from animals to people. Always wash your hands after contact with animals. It can be dangerous for children younger than 5, older adults, and sick people. It can be found in vegetables, egg, chicken, pork, fruits, and even processed food. Mechanism of food poisoning is organism ingested, it multiplies in the intestine and causes enteritis and colitis. It is sudden in onset, characterized by fever, chills, nausea, vomiting, profuse watery diarrhea that lasts for 2 to 3 days. Mortality is 1%. Convalescent carrier state lasting for several weeks may occur. Now come towards the staphylococcal food poisoning. It is as common as salmonella food poisoning. The agent is Staphylococcus aureus. It is a gram-positive facultative anaerobe. Enterotoxins of certain strains of Coagulus positive Staphylococcus aureus. At least 5 different enterotoxins have been identified. 6 may exist. Toxins can be found at optimum temperature of 35 degrees centigrade to 37 degrees centigrade. These toxins are laterally heat stable and resist boiling for 30 minutes or more. In host factors, it involves all age groups and both sex, but serious in children less than 5 years of age and older, more than 65 years of age and immunocompromised. In environmental factors, it is more prevalent in warm humid environment. Staphylococci are ubiquitous in nature and are found on the skin and in the nose and throat of humans and animals. They are common agents of viral and pyogenic infections of man and animals. Cows infected from mastitis are responsible for outbreaks of food poisoning involving milk and milk products. The foods are salad, custard, milk, and milk products which get contaminated by staphylococci. The incubation period is 1 to 8 hours. Its incubation is shortest because of the preformed toxins. The mechanism of food poisoning is that it results from ingestion of toxins preformed in the food in which bacteria have grown, that are called intradietic toxins. They are heat resistant, remain in food after organisms have died. Toxins act directly on the intestine and CNS. In clinical manifestation, it is sudden in onset, characterized by vomiting, abdominal cramps, and diarrhea. In severe cases, blood and mucus may appear. Rarely causes fever, death is uncommon. Humans and various food producing animals, colonized or infected with Staph aureus, represent sources that can introduce enterotoxigenic Staph aureus to the food matrix. During subsequent growth of Staph aureus in food, enterotoxins can be formed. Oral intake of enterotoxin leads to staphylococcal food poisoning. In this process, the organism itself is not required for an emetic response. Even if Staph aureus is inactivated during the food preparation process, the enterotoxins remain emetically active and can cause staphylococcal food poisoning. Now come towards the botulism food poisoning. It is more serious but rare and kill two-thirds of its victims. In a gent, the gent is Clostridium botulinum. It is a gram-positive anaerobe rod-shaped spore-forming bacillus. Exotoxins are generally type IE, and in human factors, it is present in humans and various animals, e.g., fowl, fish, dogs, and minks. Men and women are equally affected. In age factors, mean age of infected people is 46 years with a range from 3 to 78 years. Antitoxin is of considerable value in the prophylaxis of botulism. Environmental factors, Clostridium botulinum produce botulinum toxin under specific conditions that incorporate an anaerobic low acid and salt environment. Home preserved foods such as home canned vegetables, smoked or pickled fish, homemade cheese, and similar low acid foods. The source is the organism is widely distributed in soil, dust, and intestinal tract of animals, enters food and spores. Ingestion of toxin produced by Clostridium botulinum in food causes disease. There is no person-to-person transmission. The incubation period is 18 to 36 hours. Mechanism of food poisoning is the toxin preformed in the food that is interdietic under suitable anaerobic condition. It acts on the parasympathetic nervous system. Botulinum toxin blocks release of acetylcholine at the neuromuscular junction and stops muscular contraction. Source of trouble is low acid food that were improperly canned, and trouble signs are in the foods are clear liquids turned into milky, cracked jars, dented lids, swollen or dented cans, and off-order foods. Prevention can be made by examining all canned foods before cooking. Cook and reheat foods thoroughly. Keep cooked foods not above 140 degrees or cold below 40 degrees. Clinical manifestations. Botulism differs from other forms of food poisoning in that the gastrointestinal symptoms are very slight, that are dysphagia, diplopia, ptosis, dysarthria, blurring of vision, muscular weakness, and even quadriplegia. Fever is generally absent and consciousness is retained. Prognosis. The condition is frequently fatal, death occurring 4 to 8 days later due to respiratory or cardiac failure. Patients who recover do not develop antitoxin in the blood. Since the toxin is thermolyzed, the heating of food, which may be subjected to 100 degrees centigrade for a few minutes before use, will make it quite safe for consumption. Faint botulism. Botulism occurring in faints, it is due to infection of the gut by Clostridium botulinum with the subsequent in vivo production of toxin. Mean age of onset is 13 weeks. These factors involved are contaminated food, a survey of foods commonly fed to infant infants revealed Clostridium botulinum in specimens of corn syrup as well as honey. Environmental sources involve vacuum cleaner, dust, and soil. It is extremely rare and there is no epidemic potential. Now come towards the Clostridium perfringens food poisoning. The agent is Clostridium perfringens, also called Welchii. It is a gram-positive, rod-shaped anaerobe spore-forming bacteria. In host factors, it involves all age groups with the majority of cases between 20 to 49 years of age, involves both sexes but slightly higher prevalence in males. In environmental factors, food kept at unsafe temperature between 40 degree Fahrenheit to 1 degree Fahrenheit, perfringens can grow and multiply. Outbreaks tend to happen in overcrowded places such as hospitals, school cafeterias, prisons, and nursing homes. Outbreaks occur throughout the year with the highest prevalence in November and December. The organism has been found in feces of humans and animals and in soil, water, and air. The majority of outbreaks have been associated with the ingestion of meat dishes, and poultry. The usual story is that the has been prepared and cooked 24 hours or more before consumption and allowed to cool slowly at room temperature and then heated immediately prior to serving. The incubation period is 6 to 24 hours with a peak from 10 to 14 hours. The mechanism of food poisoning is that the spores are able to survive cooking, and if the cooked meat and poultry are not cool enough, they will germinate. The organism multiply between 30 degrees centigrade and 50 degrees centigrade and produce a variety of toxins, for example, alpha toxin and theta toxin. In clinical symptoms, there is diarrhea, abdominal cramps, little or no fever, nausea and vomiting are rare. Illness is usually short duration, usually 1 day or less. Recovery is rapid and no deaths have been reported. Come towards the Bacillus cereus food poisoning. The agent is Bacillus cereus. It is aerobic spore-bearing motile gram-positive rod. It involves all age groups and both sexes equally. In environmental factors, it is ubiquitous in soil and in raw, dried, and processed foods. The spores can survive cooking and germinate and multiply rapidly when the food is held at favorable temperatures. Outbreaks have been linked to fried rice. Recent work has shown that Bacillus cereus produces at least two distinct enterotoxins causing two distinct forms of food poisoning. One is the emetic form and the other is the diarrheal form. The emetic form has short incubation period of 1 to 6 hours. It involves upper gastrointestinal tract symptoms rather like staphylococcal food poisoning. In diarrheal form, the incubation period is longer, that is 12 to 24 hours. It involves predominantly lower intestinal tract symptoms like Clostridium perfringens food poisoning. The clinical features are diarrhea, abdominal pain, nausea, and vomiting, no fever. Recovery within 24 hours is usual. The toxins are preformed and stable. Come towards the Vibrio cholera. It is a gram-negative comma-shaped bacterium multiply in the lumen of small intestine and produce an axis toxin, that is an enterotoxin. This toxin produces diarrhea through its tract from camp system of mucosal cells of small intestine. It involves all ages and both sexes. In endemic areas, attack rate is highest in children. Human being is the only reservoir. The Vibrio cholera is destroyed in an acidity of pH 5 or lower. In immunity, natural infection confers quite effective immunity and is mediated by the local intestine immune system. Vaccination gives only temporary partial immunity for 3 to 6 months. Cholera vaccine is also available and it consists of two doses subcutaneous at the interval of 4 to 6 weeks. In environmental factors, it is most common in places with poor sanitation, crowding, war and famine, and poor environmental sanitation. Environmental factors of importance include fecal contamination, water, food, and person-to-person transmission. Fly may carry Vibrio cholera, but not vectors of proven importance. Its incubation period is 1 to 2 days, and the clinical features are asymptomatic colonization to fetal diarrhea. Onset is 2 to 3 days after injection. Abrupt onset of watery diarrhea and vomiting. It causes rice water stools, severe fluid and electrolyte loss, dehydration, metabolic acidosis, hypovolemic shock, renal failure. Death is 60% in if untreated and 1% if treated for fluid loss. Now the Escherichia coli. The agent is gram-negative protein motile. Shiga toxin produces E. coli causes food poisoning. It involves all age groups and both sexes. Commonly found found in the lower intersection of warm-blooded organisms. There is no licensed vaccine. Environmental factors, primary sources of Shiga toxin producing E. coli outbreaks are raw or undercooked ground meat products, raw milk, and fecal contamination of vegetables. Transmission is via fecal-oral route. Most E. coli strains are harmless, but some, like E. coli hemorrhagic, are hazard to human health and life. Infection sources are cattle and other ruminants are the main sources of E. coli. Uncooked meat and raw milk are the sources. The bacteria die when the food is exposed to heat, 70 degrees centigrade and higher. Fruits and vegetables, dropping of sick animals find their way into water bodies and in turn fed the soil. Incubation period is 3 to 8 days. E. coli, once in human stomach, begins producing toxins that cause serious illness. Symptoms caused by E. coli are stomach muscle spasm, diarrhea, sometimes bloody diarrhea, fever, and vomiting. Its complications are hemolytic uremic syndrome, and death rate is 3 to 5%. Coming towards the norovirus, it is also called the stomach flu or stomach bug. The agent is known as single-stranded RNA virus. It is included in the genus in the family of Falciviridae. In host factors, anyone of any age and sex can become sick from norovirus. In immunity, norovirus illness can reoccur throughout a person's lifetime. There are many different types of norovirus, and immunity to the virus is short-lived after infection. There is no licensed vaccine available. Environmental factors, outbreaks are most commonly occur in colder months when a person is infected. Their feces and movement can contain large amounts of the virus. They could secrete norovirus for 5 to 7 days after the symptoms start or longer. Infections and outbreaks are common in childcare centers, nursing homes, and overcrowded places. Having direct person-to-person contact with someone who is infected from an ill person who is preparing food or for others, touching contaminated objects in your surroundings. The incubation period is 12 to 48 hours and symptoms last for 1 to 3 days. It is norovirus is described in 1929 as winter vomiting disease. It causes diarrhea, vomiting, and stomach pain. Its infection spread by dirt content, and it is a leading cause of foodborne illnesses. It spreads by consuming contaminated food or water, touching contaminated surfaces, and then putting unwashed hand in mouth. Now come towards the prevention and control. There are three levels of prevention: primary prevention, secondary prevention, and tertiary prevention. In primary prevention, there is health promotion and specific production. In health promotion, food sanitation is important. First of all, involved is meat inspection. The food animals must be free from infection. This can be ensured by their examination by the veterinary staff, both before and after slaughter. In personal hygiene, a high standard of personal hygiene among individuals engaged in the handling, preparation, and cooking food is needed. There are 5 keys to safer food by WHO that are: keep clean, separate raw and cook thoroughly, keep food at safe temperatures, use safe water and raw materials. Food handlers, those suffering from infected wounds, boils, diarrhea, dysentery, throat infection, and etc. should be excluded from the food handling. The medical inspection of food handler is required in many countries. This is of limited value in the detection of carriers, although it will remove some sources of infection. Now here are the 5 keys to growing safer fruits and vegetables by WHO that are: practice good personal hygiene, protect fields from animal fecal contamination, use treated fecal waste, evaluate and manage risks from irrigation water, keep harvest and storage equipment clean and dry. Towards the food handling techniques, the handling of ready-to-eat foods with bare hands should be reduced to minimum. Time between preparation and consumption of food should be kept short. The importance of rapid cooling and cold storage must be stressed. Milk products and egg products should be pasteurized. Food must be thoroughly cooked. The heat must penetrate the center of the food, leaving thereby no cool spots. Most food poisoning organisms are killed at temperature over 60 degrees centigrade. In sanitary improvements, sanitation of all work surfaces, utensils, and equipment must be ensured. Food premises should be kept free from rats, mice, flies, and dust. In health education, Handlers should be educated in matters of clean habits and personal hygiene, such as frequent and thorough hand washing. In refrigeration techniques, in the prevention of bacterial food poisoning, emphasis must be placed on proper temperature control. Food should not be left in warm pantries. A few germs can multiply to millions by the next morning. Foods not eaten immediately should be kept in the cold storage to prevent bacterial multiplication and toxin production. Cook and eat at the same day is the golden rule. When foods are held between 10 degrees centigrade and 49 degrees centigrade, they are in the danger zone for bacterial growth. Cold is bacteriostatic and temperature below 4 degrees centigrade. Refrigeration temperature should not exceed this level. Now come toward the specific protection. Specific protection for Salmonella is available, and there are two licensed vaccines against Salmonella typhi that are currently available. One is orally administered live attenuated vaccine TY21A, that is Vivotif, and the other is injectable VI capsular polysaccharide vaccine, that is Typhirix or Typhim VI, immunization from animals against salmonellosis. Now, the specific protection for botulism, antitoxin is of considerable value in prophylaxis of botulism. When a cause of botulism has occurred, antitoxin should be given to all individual partaking of the food. The dose varies from 50,000 to 100,000 units IV. The antitoxin will be of no avail if the toxin is already fixed to the nervous tissue. Guanidine hydrochloride given orally in doses of 50 to 40 mg per kg of body weight has been shown to reverse the neuromuscular blockade of botulism. Active immunization with botulism toxide to prevent botulism is also available. Now come towards specific protection for Vibrio cholera. For Vibrio cholera vaccine is available. It consists of two doses that are given subcutaneous at the interval of 4 to 6 weeks. Boosters are recommended every 6 months. It is not recommended for pregnant and person with previous history of sensitivity reactions. Now come toward the investigations of food poisoning. Secure complete list of people involved and their history. All people who have shared part of food should be interviewed. They may be supplied questionnaires concerning the foods. The questionnaires involved, the questions are eating during the previous 2 days, place of consumption, time of onset of symptoms, symptoms of illness, for example, nausea, vomiting, diarrhea, abdominal pain, headache, fever, prostration, etc. in order of occurrence. Personal data such as age, sex, residence, occupation, and any other helpful information. Questionnaires may be administered to kitchen employees and those working in dining hall. In laboratory investigations, incriminated the causative agent from stool, vomitus, or remnants of food by inoculating into appropriate media to determine the total number of bacteria and the relative numbers of each kind involved. This will give a better indication of the organism involved. Stool samples of the kitchen employees and food handlers should also be investigated. The samples should be examined aerobically and anaerobically. Phase typing of the organism should be done to complete the laboratory investigation. In animal experiments, it may be necessary to feed rhesus monkey with the remnants of the food. Protection tests are useful in case of botulism. In this, a saline filtrate of food stuff is injected subcutaneously into mice protected with antitoxic sera, keeping suitable controls. Blood for antibodies, this is useful for retrospective diagnosis. In environmental study, this includes inspection of the eating place, kitchen, and questioning of food handlers regarding food preparation. Data analysis. The data should be analyzed according to the distinct methods of time, place, and person distribution. Food-specific attack rates should be calculated. A case control study may be undertaken to establish the epidemiological association between illness and intake of a particular food. Now come toward the secondary prevention, that is wrong treatment. In treatment involves the replacing the lost fluids and electrolytes and keeping up with the fluid intake are important. If diarrhea is severe, drink oral rehydration solution to replace the fluid losses and prevent dehydration. Preparations of bismuth subsalicylate can reduce the duration and severity of simple diarrhea. If diarrhea and cramps occur without bloody stools or fever, taking an antidiarrheal medication may provide asymptomatic relief, but these medications should be avoided if there is high fever or blood in the stool because they may make the illness worse. Start antimicrobial therapy accordingly when the offending agent organism has been isolated or the diagnosis has been made. In surveillance, food samples must be obtained from the food establishment periodically and subjected to laboratory analysis. If they were unsatisfactory, continuing surveillance is necessary to avoid outbreaks of foodborne diseases. Recent advances. Recent advances in the use of high pressure as an effective processing technique in the food industry. High pressure processing is a food processing method which has shown great potential in the food industry. Similar to heat treatment, high pressure processing inactivates microorganisms, denature proteins, and extends the shelf life of the food product. But in the meantime, unlike heat treatments, high pressure treatment can also maintain the quality of fresh foods with little effects on flavor and nutritional value. Furthermore, the technique is independent of the size, shape, or composition of products. In this paper, many aspects associated with applying high pressure as a processing method in the food industry are reviewed, including operating principles, effects on food quality and safety, and most significant, and commercial and research application. It is hoped that to the food industry. New biological and new compounds and treatment strategy and was flow of foodborne pathogens. This must also be pursued. Which of the following is the most common cause of food poisoning? Staph aureus. The salmonella is the correct option. At which of the following temperature will food poisoning bacteria multiply most rapidly? Yeah, 37 degrees centigrade is the correct answer. Increasing the acid content of the food is effective in preventing the growth of Clostridium botulinum is the correct answer. A deadly foodborne illness from improperly canned food is caused by the Clostridium botulinum is the correct answer. Rice water diarrhea characteristic feature of the method of successful treatment of botulism prior to appearance of botulism symptoms involves the administration of antitoxin. A person had lunch from a restaurant and after 3 hours he developed abdominal cramps, diarrhea and vomiting. This is most likely due to Staphylococcus aureus. The emphasis should be given on the short incubation period, as the incubation period of Staph is 1 to 8 hours. In botulism food poisoning, death is most commonly occur due to respiratory paralysis. As I discussed, the mechanism of food poisoning, it blocks the neuromuscular junction and causes muscular spasm. Primary source of salmonellosis is contaminated food of animal original, mainly meat, eggs, milk, and milk products, or unwashed vegetables. Yes, A is the correct answer. And these are the references. Thank you.
Thank you very much, Dr. West. मैंने आपकी प्रेजेंटेशन के लिए जहाँ से मैंने देखा है इट वाज वेरी कॉम्प्रिहेंसिव, आपने अच्छा से कॉम्प्रिहेंसिवली उसको सारे को कवर किया। मुझे बस ये बताइए कि वैक्सीनेशंस कौन-कौन सी फूड पॉइजनिंग वैक्सीनेशन आपने बताई हैं? जस्ट गिव मी अ शॉर्ट रिव्यू। आपने
मैडम साल्मोनेला की है